Hello, I just want to apologize for the quality of this video. I'm in my apartment by myself currently, so I have to just improvise and do what I could. Hello, my name is Stevie Stubbs. I'm a student nurse at Fayetteville Technical Community College. Can I please have your full name and date of birth? Checking her band, everything seems to match up. Okay, what I'm going to be doing today is a postpartum assessment on you. It shouldn't take very long. I'm going to raise the bed up to working position, wash my hands, put on a clean pair of gloves, provide for privacy. And what I'm going to do first is start with her vital signs. So if you could just put this thermometer under your tongue, I'm going to check her pulse and look at her respirations at the same time. After that, I'm going to put this blood pressure cuff on and get a reading. And then finally, I'm going to ask if you're experiencing any pain, 1 being no pain at all, and 10 being unbearable, the worst pain ever. She says she's not experiencing any pain, which is great for us. So we're going to move on. So the first thing I'm going to do in this assessment is her breasts. So first I'm going to ask if she's experiencing, did you feel any hard spots, any lumps, any redness or tenderness? She says no. I'm going to ask, are you breastfeeding? She says yes. So I'm going to ask if there is any discharge. Are her nipples intact or are they cracked? She says they're not, and she hasn't experienced any discharge, so everything seems normal. So now I'm going to palpate both of her breasts. I'm going to do so in a circular motion, and I'm really just looking for lumps or hard spots in there. Her breast feels soft. I don't feel any lumps. Her nipples are intact, and she states that there's no discomfort or pain. So that's all great. So next what I'm going to do is I'm going to inspect her uterus, but so first I would normally assess her bowel sounds, but for the sake of this, I'm going to also assess her lung sounds and her heart first. So if you could just take some deep breaths in for me and out. And now I'm just going to listen to your heart. Okay, now I'm going to listen to your bowel sounds in all 4 quadrants. Okay. Bowel sounds are active. So now what I'm going to do the fundal check. I will rewash my hands and put on new gloves. And what you're going to do is put the head of the bed down because she needs to be laying flat for this. So I'm going to try to do this here. I'm taking one pillow away. Okay. So now that she's flat, I'm going to do the 2-handed technique here. So on your first hand, you want to sit right above the symphysis pubis. And this is going to be your support hand. And another thing to note is that you need this hand here because while you're inspecting, there is a chance that you could invert the uterus, and nobody wants that to happen. So I'm going to have this support hand here, and then I'm going to take my second hand here, and this hand is going to do the palpating, and I'm going to feel around her belly button, and I'm going to try to find the top of that fundus. So I found it, and it's firm, it is midline, and it's at the umbilicus. And those are normal findings, so that is good, and that's what we want to see. So provide for privacy at all times. And at this time, I could teach her that if she's experiencing like some heavy bleeding, what she can do is massage that area for about a minute, and it can like help to refirm up her uterus and help control that bleeding. Okay, so I'm gonna fix her bed again real quick since I did that. I also would palpate her bladder, and what I'm trying to feel if it is distended. I'm gonna ask her some questions like, were you able to void before this assessment? She says she was, which is good. Her bladder isn't distended. And I'm gonna ask, when you did go use the restroom, did you experience any pain, and was there an odor? She says no, and that's good because we also want to be able to tell her that if there was, that could signify that she might have some sort of infection or a UTI, which could be common, especially with like the use of catheters during birth. Okay, so after that, I'm going to assess if she had a bowel movement. She says she hasn't had one yet. That is very common. So I'm going to teach her that it is common to have constipation after giving birth. And what she can do to help that is you can increase your fluid intake. You could eat more foods that have fiber in them. And you can also ask about a stool softener, which can also be really great, especially if she had a tear or a laceration, because the straining of trying to go could really cause her some discomfort. So a stool softener would definitely help her with that. I'm going to ask if she had passed gas, and she says she did, so that is good. And now I'm going to assess for her lochia, which is bleeding after the delivery. So what you would do, I'm going to put new gloves on, I'll put new gloves on, and I'm going to have to turn her. This is difficult with my patient, but I'm just going to turn this pillow to stimulate it. So I'm going to turn her over and check her bottom and her backside. What you want to do here is also check the pad and ask when the last time it was changed. She says it was changed an hour ago. So when you're checking it, you're going to look, it has rubra, which means it's red. It is a moderate amount, which is okay since it was changed an hour ago. And there are no clots and no odor, which is also good. You want to know, again, the odor could signify that there is an infection going on. So while you're also back here, you can also look, you're checking her perineum area. And you could also check her epidural site and see if there's any redness there or anything. Check if there's any hemorrhoids. And then I'm going to ask if she had any tears. She says yes. So with the tears, you can use RETA, the acronym, to help you with that. So you want to look for any redness, edema, ecchymosis, drainage, or approximation. Yeah. So I'm looking, there's no drainage, there's no bruising, there's no redness back here going on, so everything seems to be just fine there. I can now take my gloves off since I'm done checking her backside. We don't do home inside anymore, so I don't have to check that, but I'm going to check for DVT. So what I'm going to do is, these are her legs. First I'm going to ask her if she has any pain in her calves. I'm going to assess her legs, look for any redness. I'm going to palpate them and see if there's any warmth. There's not no pain in her calves, she says. There is no redness or swelling. You can look for dependent edema too, which could be common. She doesn't have any of that going on right now, so all that is fine. We're also going to do some more education with her. So what I can do is like signs of hemorrhaging. So what she should do is be checking that pad, and if she notes that the pad is getting saturated before an hour, that is going to signify very heavy bleeding, and she's going to want to talk to her doctor or nurse about that, because that is abnormal. We also want to note if there's any clots that are about as big as a golf ball, because that is also abnormal, and she's going to want to talk to her doctor or a nurse about that as well. You also want to teach her about how to prevent blood clots. So something she could do is by getting up and walking around a lot. That's going to help just move that blood, get it flowing, and help prevent the clots. And it could also help the tone of her uterus as well. And it can help with like reducing the bleeding that she might experience a little bit. And then another thing you want to assess last is her emotions. So while I was assessing her, she seemed, cheerful and very cooperative. Sometimes that might not be the case. You want to look out for your patient's emotions, and that's something you want to make sure you've documented as well. So I think that is pretty much the end of my assessment. I'll make sure the bed is at its lowest position with the call bell in reach. I'm going to ask her, do you need anything else from me, or do you have any more questions that I can answer? She says no, I explained everything right. Thank you. And I'm going to make sure that I take my gloves off, perform hand hygiene, and I leave to go document everything we just did.